They're just your back teeth. Who cares if you don't have them? Today I want to talk to you about a case where somebody waited probably too long to get their back teeth replaced and the damage that happened to the front teeth and what I did to help them out. So I want to discuss a patient who came to me complaining that her front teeth didn't look the same way that they used to, that she didn't have the ability to chew the same foods that she used to, and that she was really tired of having a partial that came in and out that was loose fitting and actually covered the roof of her mouth and affected the way she was able to speak as well. So let's take a close look at her smile. I want to draw your attention to these two front teeth and the direction that they're going at. They're starting to what we call splay and move. Someone has tried to close that gap and hide it with a little bit of filling material, but that's starting to deteriorate now. And we can also see in her smile the clasp or the little hook that holds a partial in place. Taking a closer look inside her mouth, we get a good view of that partial all the way in the back on both sides. And we can see this filling material here that's tried to close that gap between the two front teeth that are starting to move. We also see on the bottom that we're missing a number of these back teeth. And what happens when you're missing back teeth is that the front teeth start to do the work of the back teeth. Unfortunately, they're not intended or designed to do that. Front teeth are called incisors, which is a similar word to scissors. They're used to cut through food. But your molars are wider and used for chewing and grinding your food down. So when you don't have those teeth, the front teeth take a beating and they don't last as long. They start to move and deflect. So we see here the bottom teeth also have some wear. They're worn down. They're starting to chip. And on the x-rays and during my thorough exam, we found that there was a bit of infection on these teeth here. There's some bone loss, and unfortunately those teeth aren't doing so well. The top teeth also do have some issues as well. We see some gum recession or the gum pulling back away from the teeth, and that the crowns there are starting to deteriorate and change a different color. Here's a shot of the side here. You can see the partial here. You can see this hook here that holds onto the teeth, and there's a connector piece that you can't see that covers the roof of the mouth. The other side is very similar. We're missing these back teeth. Nothing to chew against with that upper partial. She basically wore it just to be presentable and have teeth in her smile. And here we can see the roof of the mouth, and we see this big piece of plastic that's covering the roof of the mouth. And that area is important for speaking. It's important to taste. And typically we don't like to have something that covers the roof of the mouth. It's just not natural or comfortable. The lower teeth have had quite a bit of dental work, as we can see here. They're rotated. They're not in the right positions. They're kind of going in different directions. But what you can't see on this again is the infection that's going on here. And that happens frequently, is that there's silent or painless infections. So a good dental exam would be able to tell you what's going on and how long the teeth can last and make recommendations based off of that detailed exam. So here's a view of the upper without that partial in place. And we see big missing spaces here. Spaces that aren't being used to bite or chew, where there used to be teeth. So what did we decide to do for this patient? We decided to go with some implants on the lower, replacing the teeth. And here we have a pre-made set of teeth. And you can see these little holes here. And those are holes where future implants are going to go and how we're going to attach the prosthetic or the artificial teeth to those implants. Here's a few photos of surgical guides. When I do my surgery, we want our implants to go in the exact position that we plan them, based off of your CT scan, based off of other scans of the mouth, and where the adjacent teeth are located, as well as your nerves and other vital structures that we want to avoid. So these pieces allow us to be very precise and do the implant placement in a very controlled manner. So here we have an in-treatment photo where the bottom teeth have been removed and replaced with this temporary set of healing teeth. These are all fixed into place. They don't come in or out. They don't cover the tongue space or the palate. Here's a shot of the upper arch after the implants have been placed. Here you can see these gold healing caps. Those cover up the implants and allow us to come back later and attach crowns or the natural part of the tooth to that implant. Next, we see temporary crowns here. Temporary crowns go over the teeth after they have been prepared, and it's an intermediate during the time that the permanent crowns are being made for you. Now, some people ask, why do I need temporary crowns? Or what's the importance of temporaries? Or oh, they're just temporaries, it doesn't really matter. I use my temporaries in a bit of a unique way. I use it as a test drive for the design of your final crowns. And what are your final crowns going to look like? You get a chance to go home with them, bite, chew, smile, ask somebody who you care about their opinion. And we take a look at where the teeth are located. There's a nice gentle curve here. It follows the lower lip line. It's lined up with the middle of her face here. So we can make an assessment based off of the temporaries that we make. And here's a view inside of the mouth. We have the lower temporaries. We can see that it's all one piece attached to implants. And we were able to keep as many of her upper teeth as possible. Here, moving forward, a nice close-up view of the temporary teeth. And here is the upper final set of crowns. This is the day that they went in, as well as a new lower prototype. And we call it a different term because, again, it's a prototype. It's a test of our design. We get to give the patient their teeth. They get to go home with them. Again, bite, chew, smile, give us some feedback on how things feel, how things look, and we can incorporate those changes before we make a final prosthetic. This allows us to give you a predictable outcome. I try to remove the aspect of having a surprise of what kind of teeth am I going to get. So we use the prototype in that manner so that we can know what's coming. Here's again a nice shot of the final crowns after they went in. We get beautiful coloration here. We have nice contours here that are going to allow the gums to heal up nicely, allow this person to clean effectively, and to keep as much of your natural tooth structure as possible. Here's an angle from looking at the roof of the mouth of those brand new crowns. And here's our final result after everything has healed up. So we have these beautiful crowns here on the top, keeping the natural tooth underneath, being cautious and gentle around the gums, as well as this nice final prosthetic on the bottom, or this final set of teeth that's on implants. So we design it in a way that's still able to be cleansed. You're able to clean, you're able to brush and floss and use a water pick underneath this prosthesis. And you don't have to worry about anything coming loose or coming out or covering a large portion of your mouth. A nice close-up view of the bottom set of teeth. And just as a reminder, here's the starting photo where she started at. Her smile here. We can also take a second look at her smile. Where did she start? We can see a lot of the gum tissue in her smile. And we can take a look that the bottom of the front teeth is really digging into her lip. That tells me that those teeth are too long. So during our treatment, that was one of the considerations that we had. And here is the beautiful smile that she ended up with. The teeth are no longer digging into the lower lip. Let's zoom in on that. Less gum showing on the upper teeth. A nice broad smile with back teeth that fill in that smile. And this patient was really happy with this outcome. So these are the type of results that we like to get. This is one of our fantastic cases. So I'd like to see how we can help you and how we can get you the same results. and make you happy, make you comfortable, make you speak confidently, and avoid having removable partials.